Blood vessels and, of course, the bulging varicose veins are not just unattractive. They can be signs of something that's much more serious. We're talking about vein disease. In fact, vein disease affects 75 million men and women here in the United States. We have Dr. Stephen Roth with the Vein Care Pavilion of Nashville here with some answers to some of the most common questions out there and what you can do about it. First of all, Dr. Roth, thanks for joining us this afternoon.
Thank you for having me here.
Your website, vainguys.com, so you're vein guy number one?
I'm vein guy number one.
All right. Okay, let's first get started because people may not realize just how serious this is. What are we talking about when we're talking about vein disease?
Okay. Vein disease, well, first of all, it affects so many people, up to 75 million people, so it affects a lot of people around you. You got to understand what veins do. Basically, veins deliver the blood out of our legs. That's important. They all have valves in them. These valves prevent blood from falling down our legs. So venous reflux disease is when people develop problems with the valves in the veins. They leak blood down the leg. It leads to increasing blood pressure in the veins in the legs, and that's the symptoms that people have: burning, throbbing, aching, cramping, fatigue, heaviness, swelling, as well as developing varicose veins, which are the big ropey ones, or the spider veins, which millions and millions of women, few men, but mostly women, develop.
Which are the smaller ones, so
Which
they
are the
look more
smaller
like
ones.
the little spider. Okay, we're going to start and just roll through a few of the pictures so we can kind of get an idea and some of the treatments that are actually involved. Okay, now the next picture I do believe we have, you will be able to see another vast difference. There was a difference there, but this one, there are no incisions.
No incisions here. This is somebody when we treat them for their venous reflux disease. We use a technique that is incisionless, and as you can see, this large nest of ropey, bulging varicose veins, these ugly, nasty things, and it took a very simple procedure to fix them.
Okay, and what is that procedure? What is involved?
The procedure is actually called venous closure. It's actually done in the office. It's done under local anesthetic with just a little IV sedation. Takes less than 30 minutes to do, no incisions, and when you leave the office, you resume normal activity. This treatment catheter is right through the skin, delivered into the underlying vein that has the leaky valves.
Okay.
This catheter heats up the lining of the vein, makes it close down. Once you have closed down the offending underlying vein, all the blood is forced to go out of the leg through all the normal ones. The high blood pressure in the vein starts coming down. Your leg not only feels 100 times better within 24 hours, but these ropey, bulging veins that we looked at shrink up and disappear.
Wow. How do you know if someone technically has this vein disease? What do you look for?
And that's a really good question. What you can do is through the interview, you're trying to pick up on whether or not people have the symptoms. The testing is actually done with venous ultrasound testing, which is basically scanning the veins inside, looking at the valves to see if they're leaking. And if they're leaking and with those symptoms, we then first try to make sure that people have an opportunity to do some things at home to make their legs feel better. So we will take patients through conservative management first before we rush them off to do a procedure.
Okay, let's go ahead. We've been showing a couple more pictures. So talk through what we've been seeing. We've got some more before and after, and really drastic differences here.
Huge differences, again, and believe it or not, the treatment catheter, the patient on the left is varicose veins, burning, throbbing, aching, cramping. Many years this is developed. You insert the treatment catheter essentially into the calf, deliver it up through the vein, actually up the leg. You turn the heat on, you pull the catheter down and out of the leg, and as you do that, it reduces the pressure. And this is about 4 to 6 weeks after. The pain is eliminated within 24 hours. It's that quick. People that are having aching and cramping at night, the next day, it's their first night of a restful sleep in 20-some years. It's unbelievable.
Okay, now we're talking about that pain. Now, I have another question because a lot of folks, anytime we do segments, health-related treatments, they want to know, okay, is the procedure painful? What would they need to know about that?
This procedure is not painful. We do it under local anesthetic, and we feel that giving patients a little light sedation just so they don't have to live the experience helps a lot too. But when we're done, there's absolutely zero pain because there's no incisions. There are some other techniques that are used, in particular laser technology. Laser technology uses such a high heat Recent studies have shown it causes much more pain, bruising, numbness for at least 2 months in some people. So we've stayed away from laser, and we use this particular modality, which is called radiofrequency, or the venous closure procedure.
The venous closure procedure. Now here, are these more of the spider type veins? Is that what we're looking at?
Yes, Holly, those are spider veins, and these are taken care of with a different technique called sclerotherapy, which is a very simple in-office, just takes about anywhere between 10 and 30 minutes, where you're injecting a solution using a tiny little needle to get into these veins, injecting that solution, and those spider veins are obliterated. They just go away.
Now let's quickly mention too, you briefly touched on the recovery time. I mean, how long would a procedure take? I guess it depends on really how badly the leg may be damaged with the disease. But how long would a typical procedure take, and then the healing time after? There's no true healing, but as far as looking like what they want it to look like.
From a recovery standpoint, it's wonderful. There's no pain. You resume normal activity the next day. Our triathletes, our equestrians who love to ride horses, our exercise fanatics, they're doing it the next morning. So there's absolutely no downtime. In terms of cosmetic benefit, with the sclerotherapy for the spider veins, we will see immediate results. And usually within 6 to 8 weeks is the final product. And for the big, ropey, bulging veins, usually 4 to 6 weeks is when we really see the maximal effect.
Good info. We're out of time, but quickly, does insurance cover this ever?
Insurance and Medicare cover this. In other words, you've been under our care a limited amount of time, insurance covers it, as well as Medicare.
Interesting. We appreciate your time, Dr. Roth. Thank you so much today. Very informative there. The Vein Care Pavilion of Nashville is located at 2400 Patterson Street. That is here in Nashville. You can give them a call at 329-0029. You can also find a link to their website by clicking on the More at Midday section of ours. Just go to WSMV.com. And we'll be right back with details on what's coming up on tomorrow's show. Stick around.